Hi everybody, my name is Melissa. I'm RN and I've been RN for about 10 years, but I'm not working right now. This was about 10 years ago that this happened at my previous job at a long-term care facility for children with serious illnesses and disabilities. One night, after being mandated to work an extra 8 hours after my 8-hour shift ended for a total of 16 hours, the unit I was working on had 15 children with a variety of medical problems. Some of them had tubes in their throats in which they breathed called tracheostomies. Some had tubes in their stomachs for medication called G or J tubes, and they all had the risk for seizures. I was the only nurse caring for 15 patients that night. It came time to change one of the children's tracheostomy ties, or the strings keeping the tubes in place in the throat. They needed to be changed to avoid skin breakdown and, in her case, the worsening of cystic acne around the back of her neck. This is a complex procedure that requires holding the tube in the throat while taking off old ties, disposing, and then threading the new ties around the neck to hold the tube in place. While doing so, the patient became spastic and expelled her tracheostomy tube. And then I immediately ran for help, called the code blue as loudly as I could, but there was no staff to be heard from. I returned to the room. She's turning blue. Using my training, I held the patient's hands away from her throat because they were really spastic on her throat. It was spastic, I mean that they were very tightly held up against her throat, right over where the tracheostomy tube would be. And I carefully reinserted the tube. If there had been more staff, her safety would have been assured, as 2 people would have been present to change the ties. Staffing in nursing homes should be evaluated for the complexity of each facility's population to avoid situations like this. After placing the tube back, the patient thankfully recovered well. My clinical experience saved her life. If I had not known how to reinsert the tube, the patient would have been suffocated and died. I would advocate for having respiratory therapists on staff at all times that can change tracheostomy tubes, that can suction patients per schedule and as needed for the patient's safety. Thank you.